Welcome to our Insight series on organizational well-being. Our question for this week is, what are the main program intervention options for tobacco use? Number 20. As we look at the Big Ten, the Wellness Big Ten, what are the main program intervention options for tobacco use? I'm going to be sharing a number of them that I've used over the years with different clients out of the 1,000 or so employers that I've worked with. And I'm going to be sharing with them on a continuum of an increasing cost and increasing difficulty and increasing effectiveness. That's the good part. If once we continue down the list of possible program intervention options that we can use for tobacco use in working populations. Now, we start with providing educational posters and the ability for us to discourage all forms of tobacco use and vaping. So that's a messaging and marketing kind of approach. Secondly, we can place a statement in the employee handbook that appeals to all employees to not use any tobacco products for their own health and for the health of the organization. We can remove all access to the purchase of tobacco products within or adjacent to the workplace. We can establish a no tobacco use policy in all company facilities and events. We can also establish a no vaping policy in all company facilities. We can include tobacco use questions in a wellness assessment or health risk assessment. It's still one of the most significant public health and personal health challenges that we have. We can also provide a smartphone app that helps the individual quit smoking or using tobacco products. We can include a wellness criteria of non-tobacco use in your wellness incentive program linked to a $600 to perhaps $1,800 of discount on your premium contribution for your health plan. That's where we use a series of wellness criteria to accomplish that. We also can include an emphasis on breath work and lung health within the employee wellness program, particularly, by the way, if we have some secondary exposures of occupational hazards for silicosis or for other kinds of conditions and risk. We can establish a facilitated self-help group for those who want to stop using tobacco products. We can provide a partial reimbursement of up to or at least 50% of the employee cost for completing a smoking cessation program. And again, remember, as we go down the list, they get more costly, more difficult, but more effective. And that's again our trade-off. We also can provide partial reimbursement equal to or greater than or less than for the employee's family member who completes a smoking cessation program. We can also do that to provide respiratory function testing, particularly in occupational health settings, manufacturing settings particularly, for employees who are exposed to respiratory hazards at work and use tobacco products. So we want to actually do a higher level of surveillance for those employees. We also can provide a wellness reimbursement account with an annual maximum, and that can be $500, $300, $400, whatever amount that you want to use, that can be used for a number of wellness activities, including help with tobacco use. And that's where we essentially address the tobacco issue, but do it in a softer way, in a more gentle way, if you will. And we also can provide nicotine replacement coverage in our prescription drug program so that the individuals who are wanting to quit can get some help related to nicotine replacement. We can also provide specially trained wellness coaches to help the individual quit smoking and or using tobacco products. So in summary, These are some of the kinds of main program intervention options that we can install and put into worksite settings. In summary, there are many ways to reduce the use of tobacco products by employees and their family members. Each of these interventions has its own pattern of direct cost, difficulty, and effectiveness. It's also a good idea to consider including all forms of tobacco products, both smoking and smokeless, as well as vaping, in your tobacco control efforts. Now, for more information on this topic, put the following search strings into your web browser: tips for eliminating tobacco use in the workplace, hazards of tobacco use, tobacco control options for the workplace. Next week, we will address the question, Wellness Big 10, what are the main program intervention options for improving nutrition practices among employees and their family members? For more information, please visit our website at www.chapmaninstitute.com.